One thing that maybe people don't know is that infertility is a major challenge, and it's postulated that 1 in 6 couples worldwide suffer from difficulty in conceiving. Myth in Africa is infertility is for women, but actually 60% 40% is women related, and 40%, up to 40% is due to male factors. Letrozole, it's an aromatase inhibitor, so it reduces estrogen production. So once you reduce estrogen production, you initiate a cascade that will lead to increase in follicle stimulating hormone release, and this one stimulates ovulation. And testosterone is very important for sperm count, sperm quality and count. The second most cause of infertility is sperm quality. So good morning, good afternoon, good evening, our viewers. My name is Dr. Japheth Samoei. I'm the Chief Pharmacist here at Savannah Hospital. Welcome to today's monocast. We'll be discussing mainly about fertility. So I'll take you through the basic causes of infertility, the common ones. And then majorly we'll discuss the drugs that are used to manage fertility and the options that we have here at Savannah Hospital. So thank you very much. One thing that maybe people don't know is that infertility is a major challenge, and it's postulated that 1 in 6 couples worldwide suffer from difficulty in conceiving. And when we look at the major causes, it's both, I know the myth in Africa is infertility is for women, but actually 40% is women related, and 40%, up to 40% is due to male factors, and 10 to 15% is a combination of both parties, and about 10% is remains unknown, despite maybe evaluation, what we call in science idiosyncratic, that we don't know the causes of infertility. Now, I'd like us to break it down further to the causes of infertility. We'll start with women, and then we'll go to men. So in women, like I said, it's around 40% to 50% of the reasons for difficulty can be attributed to women. And so I'll break down the causes. So the first one, that is, it's a very common, it's up to 25% of causes of infertility in women, is what we call the ovulation disorders. Now, these ovulation disorders, they are brought about by things like PCOS, that is the ovarian polycystic syndrome, thyroid function test, thyroid dysfunction, premature ovarian failure, and maybe just to go back to how conception takes place. First, you need to have ovulation to release the egg. So as you can imagine, if there is no ovulation, then there is no conception. So that's why ovulation disorders is a major factor in infertility. So the second factor is the tubal damage. So in some cases, we get the what we call the fallopian tubes. They are blocked, and the main reason for that is infection, especially chronic infections. Endometriosis is a major cause for tubal damage, and prior surgeries. When you've had many surgeries, it can affect the tubes. Also, there is uterine causes. So uterine causes, it accounts to about 10% of infertility in women, and some of these can be attributed to things like endometrial polyps, congenital abnormalities, fibroids. I know fibroids is maybe many of our viewers can relate to that. The third or the fourth, is it the third or the fourth? I think the fourth cause is the cervical factors. So when you have mucal problems, it leads to, you see, for the sperm to travel, after intercourse, for the sperm to travel, you need sufficient mucus as the mode, or the mode of which the sperm travels. So if you have issues with the mucus, then that can lead to infertility. Although that is a very small issue. Others are things like age-related decline. As you know, for women, after 35 years, there is a significant decline in chances of conceiving. The other issue is the lifestyle and health factors. So things like obesity. Obesity will reduces the chances of conception. Even underweight. You see, people assume that obese is the issue, but sometimes underweight can lead to that. Smoking, alcohol, stress. Stress is a very big issue that can cause infertility, because you see it affects the hormones. Now, when we go to men, up to 40% of infertility in couples can be attributed to men. And the reason why that is usually viewed, as it's lesser than that, is because of the health-seeking behavior. Men tend to, because of pride and what we call in Kiswahili taasubi za kiume, they don't seek that help mostly. So sometimes they say that it's mostly attributed to women, but in actual sense, even men have a role to play in this. And the main cause in men is sperm production issues. So when you have sperm issues, it can either be either of the three. It could either be a low count. When we have low sperm count, it can attribute to infertility, or poor motility. So you could have enough sperms, but they can't swim. If they can't swim, they won't reach the promised land, or abnormal sperm shape. I'm sure most of our viewers can picture how a normal sperm looks like. It looks like a spear. So if you have an abnormal shape, it affects the motility of the sperms. The other issue is hormonal imbalance. So this hormonal imbalance affects both men and women, but for men, it's usually due to low testosterone. So if you have low testosterone, there is a pituitary and thyroid issues. Thyroid issues affects both men and women in this regard. And the other issue is the obstruction. So there are ducts that transport these sperms. So if you have blockages or obstructions of those ducts, then it leads to infertility. Causes for these are things like infections, surgeries, and sometimes congenital defects can lead to blockages. There is something called varicocele, and it accounts for up to 15% of infertility in men. This is when the veins are enlarged. So veins in the scrotum are enlarged. So what essentially this leads to is it affects the sperm quality. And the other factor is up to 10% of infertility in men is caused by lifestyle and environmental factors. Same as women: alcohol, smoking, drug use, obesity, exposure to toxins, stress, can lead to infertility in men. Other issues is the genetic conditions, and this affects to up to 5% of men. This is because of the Y chromosome. Like, you know, men have the XY, so the Y chromosome deletions, and there's a syndrome called the Klinefelter syndrome that affects the Y chromosome in men. And it's a major issue in infertility when it comes to genetic conditions in men. Combined and unexplained, I said it's 15 to 20%, where both parties have an attributing factor. And sometimes in about 10%, all tests can be normal, but still there is infertility. That is what I call idiosyncratic causes. So when evaluating fertility, it's always good to look at both the partners, not only the women, both the man and the woman, so that we can know, we can understand the root cause. Now let's dive into the drugs. So we'll start with the drugs for women, and in understanding the pharmacological solution to these fertility issues, we must start with the causes, because these pharmacological remedies, they are a solution to the causes that we have talked about. So the first one, we'll delve into the women drugs. So the first one is what we call clomiphene. So clomiphene is a selective estrogen receptor modulator, what we call SERM. They are selective estrogen receptor modulator, and some of the drugs that we have, I don't think I have one with me right now, but some of the brands, the most common brand that we know is Clomid. I'll take you through briefly how it works. So it blocks the estrogen receptors in the brain. So if you block the estrogen receptors in the brain, it will trigger the pituitary to release more what we call the follicle stimulating hormone. Now, what the follicle stimulating hormone is, it stimulates the follicles, and once you stimulate the follicles, it leads to ovulation. You remember the first cause and the main cause of infertility in women, I alluded to ovulation. So basically what Clomid does is it promotes ovulation. So basically it comes in 50 milligrams and 100 milligrams. So usually it's taken between 50 to 100 milligrams daily for about 5 days. And it starts from day 2 to 5 of the menstrual cycle. That way you'll have a better chance of promoting ovulation. So like I said, the brands in Kenya, like Clomid. Clomid is a very common brand that is available in Kenya, readily available in major outlets. So the second drug that we are going to discuss is letrozole. Letrozole, it's an aromatase inhibitor. So it reduces estrogen production. So once you reduce estrogen production, you initiate a cascade that will lead to increase in follicle stimulating hormone release. And this one stimulates ovulation. I think with me, I have the main brand. We have Letros, we have Letroday, we have Mamazole. There are so many brands that are available in Kenya that are aromatase inhibitors. So basically this one, it typically comes in 2.5 milligrams. So you take 2.5 milligrams daily for 5 days. And again, you start between day 3 and day 5 of your cycle. Remember Clomid, same time, around day 2 to day 5, take for 5 days. Basically, these two drugs promote ovulation. So it addresses the first main cause of infertility in women. And this is specifically preferred when there is polycystic ovarian syndrome, PCOS. So in PCOS-related infertility, we prefer to use letrozole to Clomid. The third drug that I want us to tackle is a group of drugs, gonadotropins. So these are basically menotropins, follicle stimulating hormone, HCG, human gonadotrophic hormone, HMG. So some of the examples that we have readily in our market is pyretrine. The other one is Coriage. So basically, the most of these ones are, because they are direct hormones, they're injectables, so we inject to the patients. And how they work is they directly. Now the first two were indirect, so they're working to increase FSH release, but indirectly. But for gonadotrophins, what they do is they directly stimulate the ovaries to produce multiple follicles. So usually it's either subcutaneous or intramuscular injection, and they're usually given in an hospital setting because you need close monitoring with ultrasound. And this one, as a side note, these ones are mainly used, or they are also used in assisted reproductive techniques like the IVF and IUI. So one of the side effects of this drug, and also partly letrozole, is it can lead to conceiving multiple, what do I call? Can lead to one getting twins. So it's a side effect, but you'd assume that someone seeking this intervention, that would be a blessing, because basically they stimulate not one follicle but several. So the fourth remedy is the progesterone supplements. So these can either be natural or synthetic progesterone. And how they work is progesterone, for our viewers, progesterone is the pregnancy. It's also known as the pregnancy hormone. So it prepares and supports the uterine lining. You see, for someone to maintain the pregnancy, the stomach lining has to be thick enough to promote implantation and to support the pregnancy and to avoid miscarriage. That's why in most cases, if you've had multiple miscarriages, you're given progesterone because it's the hormone that supports pregnancy. So that is the mechanism of action. So this one can either be taken orally, it can be taken vaginally, it can also be taken as an injection. So some of the brands that are available in Kenya, they're like Provera, there's Susten, there are so many that are available in Kenya. Now, the other I'd call this one an adjunct treatment or supportive therapy. These are antioxidants that are mostly used to support pregnancy and to support conception. And these ones, we have so many that are available. So most of them, they contain what we call the myo-inositol, the chromium, vitamin D3. As you can see, these are mainly antioxidants and supplements that promote fertility. And so before we go to the men's drugs, I have a few drugs here that I can demonstrate for female infertility. So for the supplements, mainly, so we have things like Pregnacare Conception, we have Oligocare. So mostly these ones contain myo-inositol and so many other antioxidants. We have Ovacare Myo. So Ovacare Myo, it treats both PCOS and also infertility at one go. We have things like Dufaston, so this one, they support also the hormonal side. Letrozole, we've gone through it. MyoPCOS. So basically, Ovacare, it is an adjunct. So it contains antioxidants and supportive therapy for, like I said, so the main composition is what you call the myo-inositol. Myo-inositol is a very powerful antioxidant. So when you have an antioxidant, it streamlines the process of conception. So these ones are used as an adjunct therapy. And initially, before you go into the first four remedies, you try these ones first, because you see sometimes it could be just maybe your body needs reconditioning so that you can conceive. Now, when these ones fail, or they can be used in combination with the first three. Now, others are just used to regulate hormones. when you regulate hormones, you find that most women who have irregular cycles, they tend to struggle to conceive. Not that they can't, but they can conceive, but it's not as easy as someone who has a regular cycle. So sometimes you use hormones to regularize that cycle, so that you can even predict when ovulation takes place, and then you can focus on things like sexual intercourse during that time. I think we are done for women, so we can go to fertility drugs for men. And some of these drugs, they go both ways. So something like clomiphene is the same as for women, but now how it works in men is slightly different from how it works in women. So in men, one of the causes of infertility in men, I said, was low testosterone levels. So if you give someone a clomiphene, for example, a man, this will block the estrogen feedback. So by blocking the estrogen feedback, it will increase testosterone production. And testosterone is very important for sperm count, sperm quality and count. The second most cause of infertility in men is sperm quality. So giving them clomiphene, they are given around 25 to 50 milligrams daily. This one can be used long term, but under medical supervision. You remember, for women it's used for around 5 days, but this one is used for long term. When you use clomiphene long term, it blocks the estrogen feedback, the feedback loop for estrogen. The second option for men is gonadotropins, same FSH, HCG, HMG for men. So this one, they directly stimulate the sperm production. And how it works, it stimulates the testes to produce testosterone. And testosterone is very crucial in the process of production of sperms, what we call spermatogenesis. So gonadotropins, basically, they improve sperm production. So the brands that are available in Kenya, we have Gonal F, we have Pregenile, and many others that are available. Also for men, the third option can be letrozole. So letrozole, it's less commonly used in men as compared to women, but it can still be used, and it raises the testosterone levels. But the fourth and the most common drugs or group of drugs that are used in male infertility is the antioxidants. So these antioxidants and supportive therapies. So these it's a group of drugs that they mainly contain selenium, they contain carnitine, they contain vitamins, especially vitamin C and vitamin E. These are very powerful antioxidants. So they reduce the oxidative stress and improve sperm motility. So sperm motility was one of the main causes of infertility in men. They also vitamin C and E, and especially selenium and L-carnitine, to be specific, is very important in DNA integrity. So they take care of the DNA, and and these drugs are available in over-the-counter supplements in so many formulations. So you can find them in tablets, in capsules, in powders. So the most common brand that is available in Kenya is Wellman. There is Wellman Conception. So Wellman Conception, these are they promote fertility. There is also Fertilion M. There is Oligocare for men as well. Oligocare is for men, Overcare is for women, and these are the same group of drugs. There is also Mamavit, so Mamavit M is for men. So whenever you see these fertility drugs, it's either M or F. So, and these are mainly the antioxidants and supportive therapies. So whenever you see M, that is for men. Whenever you see F, that is for women. And whenever you see plus, especially for those for women, it also treats PCOS. So that is why there's plus in there. So that is basically it's a comprehensive overview of the drugs that we use in treating these infertility issues, and we encourage couples to seek professional help, especially in this day and era. It's not an issue of blame, so we encourage couples to seek professional evaluation, and the earlier the better. The earlier the better. Like I said, especially for women after the age of 35, there's a decline. There's a decline in the chances of conception. So, as a closing remark, thank you very much for listening to this podcast. And remember, infertility is a challenge. It's a challenge that we can all face. But the good news is that it is treatable. And here at Savannah Hospital, we are committed to working this journey with you. So come, we have all these options available. We have very able obs-gyn doctors, specialists that can work this journey with you. And with those very many stories, thank you very much. And we look forward to, just in case you have this issue, we look forward to working this journey with you to create a solution for this issue. Thank you very much.